Oh my gosh, Amy. Look at her wound. It's so big. It looks like one of those MRSA infections or something. But you know, who understands those MRSA infections anyway? It only infects tens and thousands of people. I mean, her wound is just so swollen. I know, it's so gross. It's like purulent. I mean,
I like warm hoops and I cannot lie. As bacterias can't deny. When a person walks in who's weeping over moving an abscess filled with pus, I infect you. When I pull out your stuff, cause you notice that wound looks rough. Deep in the flesh I'm feeding. I'm hooked and I can't stop eating. Ooh baby, I wanna infect you. It infects
my colleagues tried to warn me and now that MRSA's got me.
Ooh, methicillin. You say you wanna get in my skin? Well, treat me, cause I ain't the average colony. I see them swabbing, tag with culturing.
It's hot, it's red, I gotta prevent that spread.
I'm tired of PPE and keeping your hands clean. Take the antibacterium, he'll agree. You can't get rid of me.
So, doctor, my patient got MRSA.
Take that fake go virus.
The patient got MRSA.
How are you today?
Good.
I'm going to be your nurse. I want to talk to you about MRSA.
What is MRSA anyway?
Okay, good question. MRSA is a staph infection, and it's resistant to certain antibiotics such as methicillin, oxacillin, amoxicillin, and penicillin. It came along about 50 years ago, and it's easily transmitted through the hospitals. In the community, most MRSA occur as skin infections, and the more severe or potentially life-threatening MRSA infections occur most frequently among patients in healthcare settings, such as patients with central lines, urinary catheters, and patients on ventilators, also ICU patients, patients on dialysis, and patients with surgical site infections.
So how do you get it?
It's transmitted through direct contact with an individual who has MRSA or who has had MRSA. It's also, you can get it on contaminated surfaces such as doorknobs, countertops, floors, sinks, etc. Did you have any symptoms of MRSA when you came in?
Well, I had symptoms of skin breakdown. I had an area that was red and swollen, and it was painful, and I had some pus and drainage, but I thought it was just fire bite.
Correct. Okay, those are all symptoms of MRSA. MRSA commonly occurs on your skin, on visible skin, such as traumas and abrasions and cuts, usually areas that are covered with hair, like on the back of your neck, your armpits. Also, men with beards usually get them there, and also on your groin area and your buttocks. Severe infections cause more severe and potentially life-threatening infections such as bloodstream infections, surgical site infections, pneumonia. You can also develop a fever, chills, low blood pressure, joint pain, severe headache, shortness of breath, and also you can have a rash all over your body. So all these symptoms need to be taken care of quickly, so you need to get to your physician if you see any of these.
Okay. Well, the doctor told me that the mainstay of treatment is the incision and drainage of the hot lesion whenever possible. However, the doctor said that systemic antibiotics, vancomycin, are required in the case of fever, cellulitis, comorbidities, young and advanced age, rapidly progressive infection, sensitive infection site, and minimal response to the incision and drainage.
Correct. Your doctor told you very good. So he must have came in and talked to you a lot today. That is all true. Do you have any other questions regarding MRSA?
What is the hospital doing to prevent MRSA infections?
Oh, that's a good question. Right now, strategies are aimed at combating MRSA in the hospital settings, which include identifying the colonized patients through surveillance, prudent antibiotics, contact precautions, education, and appropriate use of decolonization. Also, regular hand washing with soap and alcohol are good techniques, and we do it before and after we see a patient. Medical personnel should also use contact precautions like gloves, gowns, sometimes masks in serious situations. We clean the patient's skin before putting lines or urinary catheters in. And we also like to elevate the patient's head who's on a ventilator about at least 30 degrees. We are also isolating patients known to be colonized with MRSA and cleaning patients' rooms and operating rooms with germ-killing bleach. And we also do not like to share personal items with other people who are not infected with MRSA. Are you going home today?
Yes.
Okay. Well, when you go home, it's really important that you do your laundry a different way than you usually do it. We like to educate our patients on using gloves to handle the dirty laundry, and we like you to hold it away from your body and put it into the washer machine in hot water. And if you have bleach, we really recommend that because it helps kill the bacteria. After you do your laundry, remove your gloves and wash your hands. Also, when you go home, we want you to keep yourself healthy, exercise, avoid stress, quit smoking if you smoke, and also just keep your skin clean. And if you have any symptoms, again, go to the doctor.
Okay.
Do you have any other questions? Okay, good. Well, if you need anything, let me know. Use your call bell and I'll come to get you, okay? Thank you.